Hi, I'm Dr. Todd Snyder, and welcome to this 8-episode discussion on smile design. I'm going to cover how I evaluate my patients and implement my smile design fundamentals for evaluating patients' smiles. This is obviously not meant to be all-inclusive, but rather meant to give you a solid foundation to build from and to use starting tomorrow with your patients. Now, we go into greater depth on this subject inside my online training programs, but for the instance of Instagram, we're going to keep it kind of short. So obviously the first thing we're going to do is look at the overall appearance of the face when we're evaluating a patient's smile. So we're not looking at teeth so much as we're looking at the whole face to begin with. And this is just to get a quick global view of the face. Now we can do this in one of two ways. We can obviously do it while talking with the patient during a consultation, but I find you'll get a lot more value if you take photographs and you look at the images with the patient so you can highlight things you see and get input from the patient as to what they see. So to start, I'm looking at the entire face. I'm evaluating symmetry in the face. I'm looking at the eyes, the nose, the ears. Are they all symmetric or are they at different heights? I'm looking at the midline. Is it off to one side or another? I'm looking at the lips. Are they symmetric on either side of the midline? I'm looking at the corners of the mouth. I'm looking for symmetry there. I'm looking for the midline of the face and how it relates to the philtrum. So I'm looking at a global overall assessment. Now notice in this example, the patient's nose is slightly asymmetric. It's positioned slightly to her right-hand side. Her right ear is slightly higher. Her eyebrow is slightly higher. Okay, so all of these things on her right side are a little higher, a little out of place. She's a little asymmetric on the right side, it would appear. And so we're looking at all of this to make a better determination of things that we might be able to change with our dentistry, or things that maybe someone else outside of our field could change, or maybe something that we need to draw attention to because it may be distracting and pulling our eyes when we're trying to evaluate the smile. Now, however, her smile, when we're looking at that, well, it's pretty symmetric, it would seem, or at least from the image. Now you can see when we add grid lines, how we start to see more of the symmetry as far as the interpupillary line. We can see the lips, we can see the midline, that pretty much what we work with on the face, with the lips and the teeth, is pretty much symmetric. And you can obviously do this with various types of editing software. Now, in the next image, I want you to look at the patient's profile at rest to see if we have good lip position and display. If we have deficiencies or excessive lip posture, we want to address it when we're working on the teeth if possible, or point it out ahead of time. So if we want to bring maybe the teeth more forward to give her more lip support, or we want to pull the lips back because she has too much lip display because of the tooth position, we can do all of those with our dentistry. What we also want to know, is her lip posture due to maybe various types of fillers or plastic surgery, as that's going to limit maybe what we can do with our teeth. So again, pointing these out ahead of time becomes very important for documenting them so that we have potential communication on the subject so we have better success. Now, you'll notice in this example, again, if we drop a line, we'll see for reference that we can see her lip is in a pretty good position in relation to her forehead. The lower lip either being on the same line or set slightly back from the upper lip. Chin position should also be noted. Again, maybe we want to look at doing orthognathic surgery or orthodontics, and so we want to evaluate these at the same time to have a discussion. Remember, all of these items are important to evaluate the person at rest in the photographs. And so I'm looking for flaws that that are potentially going to distract us from the case, and I point them out before we look at the smile, because these are things I can't personally change. And if we're going to address them, we want to address them earlier potentially, or know that we will manage them later on after doing the dentistry. So stay tuned for the next episode, where I'm going to share a unique tip to evaluate symmetry in a person's face and smile.